We are now live, sir. Please go ahead.
Good afternoon, welcome, namaskar to everyone. Thank you, all of you, for joining us on this wonderful afternoon in our another edition of a webinar in the series Illness to Wellness. And today's topic that we are bringing up and we are going to discuss is diabetes free India. Diabetes free India is a dream. I would say diabetes is a disease, a chronic disease, which has which has affected literally most of the country and the families. I don't think there would be hardly any person in our country who's listening to us who may not be having diabetes or someone with diabetes in their family or in their neighborhood or among their friends. So this is something which we all have to worry about. Why do we have to worry about diabetes? We have to worry about diabetes because diabetes brings with itself complications. There are many complications of diabetes if it is not controlled. It is a myriad of problems bundled together. So it leads to decreased lifespan, disability, lots of suffering. But one very interesting thing about diabetes is the type 2 diabetes, which is more prevalent. There are almost 8 crore people in our country suffering from diabetes. And 95% of that diabetes may be preventable. Have you ever thought of it? So, such a huge economic burden, such a big suffering for everyone may actually be prevented to certain extent. So, this is one thing that we are going to focus on today. And we have very eminent specialists, panelists from all over the country who are going to enlighten us and who are going to give us their point of views, who are going to help us come out of this situation. I would like to thank SOCHM for organizing this webinar, for getting us all together. And I would like to say that we are celebrating the World Diabetes Day, which happens every year on 14th of November with this webinar. So I would like to uh, invite Anil Rajput sir, who is the chairperson of the CSR committee of SOCHM, to start the session and to begin this webinar. Sir, please.
Thank you very much for your introduction, Dr. Rajesh Kesri. It gives me immense pleasure in welcoming a very distinguished panel consisting of Dr. Panchi Sabu, President, Research Society for Study of Diabetes in India. I think Colonel Dr. Sudhir Tripathi is joining us shortly. Dr. Dinesh Agarwal, Senior Consultant with RSSDI Assam Chapter. Dr. Kaushik Datta, Founder and Co-Director, Thought Arbitrage Research Institute, New Delhi. And of course, our most important person who conducts these events for us for last so many years, Dr. Rajesh Kesri, Founder and Director of Total Care Control, Delhi NCR. I would like to welcome everybody to this webinar on Diabetes Free India, organized in the light of World Diabetes Day by SHM under its Illness to Wellness campaign. The World Diabetes Day began in 1991 by International Diabetes Federation and the World Health Organization in response to growing concerns about the escalating health crisis posed by diabetes. Thereafter, it became an official United Nations Day in 2006 with the passage of United Nations resolution. India is the world's largest diabetes awareness campaign. It is the world's largest diabetes awareness campaign, reaching a global audience of over 1 billion people in more than 160 countries. The campaign draws attention on issues of paramount importance and sheds light on various and complex aspects of this non-communicable disease. This day is marked every year on 14th November, as Dr. Kesri just mentioned, the birthday of Sir Frederick Banting, who co-discovered insulin along with Charles Best in 1922. This year, the world celebrates the 100th anniversary of the discovery of insulin. This pioneering feat transformed type 1 diabetes from once a fatal diagnosis into a chronic, medically manageable condition. Uncontrolled diabetes, as we are aware, is a serious and potentially debilitating and life-threatening non-communicable disease that can take away a heavy toll on individuals and their families, as well as on our healthcare system. Unchecked type 1 diabetes can be serious, and people with untreated type 2 diabetes are at the risk of serious and life-threatening complications such as heart attack, stroke, kidney failure, blindness, and lower limb amputation resulting from diabetic neuropathy. India is home to nearly 80 million diabetes. 1 in 6 people in diabetes in the world are from India. It is the second highest in the world. This number is expected to rise to a staggering 134 million in the next 25 years. To make matter worse, researchers have estimated that 57% of cases remain undiagnosed. This is particularly concerning, as the risk of serious complications increases when people do not take medications to control their blood sugar. According to the IDF Diabetes Atlas, over 1 million deaths are attributed to diabetes in India in the year 2019. In addition, it is important to state the findings of recent report titled Non-Communicable Diseases in India, prepared by Thought Arbitrage for SHM. According to the report, diabetes is one of the top 3 most prevalent non-communicable diseases in India. It makes an alarming observation that non-communicable diseases increase after 18 years and show a quantum leap when an individual crosses the age of 35 years. It has found that more than 2/3 of individuals suffering from non-communicable diseases are in the most productive life age group of between 26 and 50. This is disturbing and indicates the grim reality that the burden of non-communicable diseases on India is long-lasting, given that 62.5% of India's population is aged between 15 and 59 years. The recent onslaught of COVID-19 virus has impacted our lungs, heart, kidney, liver, blood, etc., and caused extreme anxiety and distress. The American Diabetes Association has stated that people with diabetes are more likely to have serious complications from COVID-19. Mucormycosis, described as a complication of COVID-19, which has been reported the most from India, is possibly explained by high prevalence of diabetes in our country. Therefore, it is common sense that in the backdrop of COVID, better diabetes management can improve body's ability to counter the virus, and under these circumstances, this needs to be looked at from the whole new perspective. Following a balanced lifestyle, which can include yoga, walking, cycling, running, weightlifting, all depending upon one's fitness level, eating a diet rich in vitamins, minerals, low in sodium and sugar, high in fiber, proper hydration, along with weight management, adequate sleep, and mental stimulation are all important steps in controlling, delaying, and averting the onset of this disease. In April this year, the World Health Organization launched the Global Diabetes Compact, which aims to bring a much needed boost in our efforts to prevent diabetes and bring treatment to all who need it. The compact focuses on catalyzing progress by setting global coverage targets for diabetes care. Diabetes has been seriously underrated as a global public health issue, and the world can no longer ignore it. It needs to accept this reality and focus on addressing it head on. Despite the enormous growth in our understanding of diabetes and its complications, we are still far from bringing the situation under control. Therefore, under these circumstances, this subject deserves our undivided attention. We are today joined by eminent personalities who have deep knowledge of today's subject, and I welcome them once again and look forward to an enriching discussion. I wish this webinar a great success, and I would like to thank each and everyone once again for sparing their valuable time and coming and joining us for this webinar. Thank you so very much once again.
Thank you so much, sir. Thank you so much, Anil Rajputji, for giving this very nice and elaborate introduction about diabetes, about the problem, the extent, and the purposes of today's webinar. Now, I'd like to give a brief introduction of our panelists, our distinguished esteemed panelists, even though I'm sure all the listeners know them and have heard about them already, but still, it would be a token introduction. First of all, I'm so thankful to Dr. Banshi Sabhuji. He's an MD, PhD. He's the president of RSSDI. He's the president of Indian Obesity Society. He's the honorary secretary of Diabetes in Asia Study Group and honorary secretary of Diabetes India. He's launched the project Diabetes Free India 2030, which was acknowledged by the President of India, Shri Pranab Mukherjee. He has a number of fellowships to his credit. He's honored with the Fellowship of American College of Endocrinology, American College of Physicians, and International College of Nutrition, and Royal College of Physicians, Glasgow, Edinburgh, London, and M&M's Diabetology. So thank you so much once again, and once again, welcome to the podium, Dr. Banshi Sabhu sir. He has a number of publications to his credit, and there are so many accolades to him that it would take a very long discourse to elaborate on all of them. Thank you so much, sir, for being here. I would like to welcome Dr. Dinesh Agrawal, who's a senior consultant and internist. He's the head of Department of Medicine, Marwari Hospital. He's a member secretary, Hospital Ethics Committee. He's the vice chairman of RSSDI Assam chapter. He's the course director of Advanced Certificate Course in Diabetology, which is affiliated with RSSDI and JNU. He's a scientific member of Northeastern Diabetes Society, and he's the honorary treasurer of All India for advancing research in obesity, Assam chapter. He has a number of publications in peer-reviewed journals to his credit, and his significant achievements are that he's been a faculty both regional and national in field of diabetes and medicine in multiple national and international conferences. He's been awarded Times Best Internist and Diabetologist Award in Assam in 2019, and he has participated as principal investigator in many clinical trials, both nationally and globally. So thank you so much, Dr. Dinesh Agrawal, for sparing your time and for being with us, and welcome once again. I'd also like to welcome Shri Kaushik Dattaji, who is the founder and director of Thought Arbitrage, that is a research institute which has conducted a wonderful survey, which we would request him to shortly allude upon to. I would also like to introduce Dr. Colonel Sudhir Tripathi. He is the chairperson, head of department, and consultant endocrinologist at Sir Gangaram Hospital with over 4 decades of experience, and he's from the armed forces. So welcome, sir. Welcome once again. Now, I won't be taking much time. I would request Sri Kaushik Dattaji to tell us about the findings of the survey that he has done, that has been conducted by Thought Arbitrage, and it's a big survey. Actually, more than 2 lakh people were interviewed all over the country, which included 22 states, to assess the condition of non-communicable disease. So I would request him to tell us something about the condition of diabetes in our country. Kaushik Dattaji.
Thank you so much.
Can you be a bit louder, please?
Yes, sir. Just saying. Just saying. Let me just put the presentation up. This will take. Can you see the presentation?
Yes, we can see that.
Perfect. Good afternoon, and thank you very much for inviting us to do this presentation.
Please be a bit more louder if possible, or come
Okay.
close to the microphone.
Is it better?
Yes, definitely.
Let me see. Yeah. So this study was done, like Dr. Kesri said, with 233,000 survey respondents. So it makes it one of the largest surveys in the country, and with 673 public health offices, which is basically the health centers, and in across 21 states. And the sample size was designed with an error rate of 5%. So this was a fairly large sample, and the results have been statistically tested for significance. And what does the result the survey actually say? And this is in relation to diabetes. This survey was for all NCTs, but we have taken out and extracted data for this study for diabetes. So the prevalence of diabetes is among all respondents in the sample who suffered from diabetes. About 3% of all of them having NCDs suffer from diabetes. So the prevalence of diabetes is actually extremely high. And the second thing is that as a person moves, like Mr. Rajput said, over 35 years, you see the prevalence significantly increases, and it kind of doubles between 36 and 45 to above 60. So in the 15 years, your prevalence and your chances of getting diabetes is actually doubles. So that makes it extremely high risk as a non-communicable disease. The other thing that the study says is that the prevalence is higher among males than in females, and this finding of the study is also supported by the National Health Survey 5 results, and the prevalence is more in rural areas compared to urban areas compared to rural areas. But having said that, in rural areas, because of the less access to healthcare and other systems, It could be that we have a high amount of unchecked diabetes or unreported diabetes, which might actually be prevalent, which is not detected. So the statistics actually ends up, somebody not reporting a condition, but actually having that. So whatever the data currently says is that in urban areas you have a higher prevalence than rural, and roughly about 16.8% of the male population above 15 years suffer from diabetes, which actually makes it fairly. And when I actually run you through the rest of the data, it makes diabetes one of the diseases that are alarmingly alarming amount of morbidity for us. So diabetes has got a huge amount of comorbidity, which means that if you have diabetes, your chances of having other diseases is that much higher. So there's a correlation of diabetes with heart diseases, which is 12.6. With hypertension, it's 19.3. So if you have diabetes, the chances of you having these diseases is that much higher. And on the other side, if you have hypertension, the chances of having diabetes is about 24.3%. So these are all. So that means if you have diabetes, it's not that just diabetes as a disease that actually that you are confronted with. It also means that there are multiple other diseases of comorbidity that might exist with you. If you look at the map and from the color, diabetes is higher in the southern states, and it moves up to the eastern states, and it's a relative. So that doesn't mean that in northern states you don't have it, but it has got lower prevalence in Uttar Pradesh and Rajasthan as compared to east and the south, and that similar results are also shown by the National Health Survey. So what are the things that are actually causes diabetes? First is, if you take the first three, I mean the food that we eat, lack of activity, and also low intake of fruits and vegetables. One is that fried, junk, street food, processed food, high salt. These and coupled with high consumption of sugar drinks and alcohol, these are some of the conditions that actually causes other relatively high causes for diabetes. And since this is also manageable and also linked to lifestyles, so the more we actually can reduce the factors that actually cause them, the easier it is for us to manage it. The survey result says in terms of the risk factors as compared to what the International Health Matrix, which is the WHO standard, say, it's roughly the same for India. The survey results, the left side is the Indian risk, on the right side is the WHO's risk. The risks are the same, except that it just one of the a factor might have a change in the way it is presented from the point of view of prevalence or hierarchy. But otherwise, it's more or less the same. It's the dietary risk, the kind of food we eat, low physical activity, alcohol, air pollution, and stress, and tobacco consumption, which is also one of them, but it's a lower risk. How long does it take when people have it? This is actually one of the worrying signs, that people live with diabetes for at least 3 years, or in and about at least 6 months to 3 years with diabetes before it's first diagnosed. That means unchecked diabetes and unreported diabetes is one of the major concerns that we have. And this is one of the things that, I mean, I'm sure there'll be a lot of deliberation of how to control this, because this is actually one of the big risk factors. The other thing is that when do they actually seek treatment? First of all, it is an unchecked diabetes, unreported diabetes, and then if you see, roughly about 60% of the people suffering from diabetes actually take treatment between 1 and 3 years of having the disease. So by that time, significant damage has been done, and and from coming from that is that it needs healthcare, it needs management, it needs awareness, it needs a lot of other things that the esteemed panel out here would both talk about, the medical interventions and the non-medical and other interventions that would help us deal with this disease, which is deadly, and it's a silent killer for millions of people in this country. So thank you very much. If you have any questions on the survey, you can put it on the chat box, or you can ask Mr. Kesri, Dr. Kesri about it. And thank you very much. Thank you for having me. Over to you, Dr. Kesri.
Thank you so much, Kaushik ji, for this presentation, because most of the points that we mentioned, actually, we are seeing in concordance. These are in concordance with the clinical practices that we all having. Now, if no one has come up with any questions, I'd like to move on forward to the discussion about the possibility of diabetes-free India. Dr. Banshi Sabu sir, I would like to come to you with this. We see that as Shri Anil Rajput ji was also mentioning in his beginning, in his forward, that diabetes goes unnoticed. As he mentioned that in one of the studies, 57% of diabetics are not aware of being diabetics. So, sir, what would you like to say about this? And how can they be detected? How can they get to know that they have diabetes? And I would also request you to throw some light on the huge work that is being done by RSSDI under your leadership in the form of Defeat Diabetes campaign and the world record that has been made through the huge efforts of RSSDI.
First of all, thanks Rajesh and SOCHM for giving me an opportunity and inviting me on this platform. And SOCHM had given me an opportunity. So 57% or maybe 45% in the urban population who are remaining undetected, they are not knowing the diabetes. The problem is diabetes is a disease which does not have any symptom initially. And many of them are having diabetes, but they don't go for regular checkup. And that's the reason we had come out with the Indian Diabetes Risk Score. And I'm sure you know about the IDRS. And there is internationally also the risk score who are at the risk of developing diabetes. Now, internationally, or India had adopted that those who are above the age of 30, at least they should check their sugar every 3 years. This is what for a normal Indian adults. And just before 12 days only, me and Dr. Anup Mishra and other consultants from India had come out with a paper where we had suggested that it is not above the age of 30, even below the age of 30, it should be also done. And below the age of up to 25, the age which is 30 at present, the government of India and ICMR had adopted. Now it should become 25. And above that, every 3 years, one should go for his sugar level to be checked out. But more than that, this time RSSDI, if you were there on 2 days back, in an inauguration, we had come out with the Indian Diabetes Risk Score, and now we have come with an app. So, in simple app where you have to just measure your waist circumference, family history, and exercise history and age of the person. And with these 4 parameters, one can know whether you are at the risk of developing diabetes or not. So one part is that everyone should get it checked above the age of 25, irrespective of the risk factor. And if the risk factor for anyone, even below that age also is there, then they should check for the sugar. Now, in this Defeat Diabetes campaign, one of our important part of it is testing for everyone. As such, we had put test, track, and treat. So the testing is very important because, as I told you, more than 50% of the lay person, they don't know they are having diabetes. And that's the reason everyone should get it tested. As above the age of 25, all adults with the risk factor, they should be tested for the sugar. So the sugar testing is one of the most important thing which we can do. Now, at what time? Should we do it morning? Should we do the randomly? So now this, when we are doing a testing campaign across the country, it's not possible that everyone will reach to the place where we are doing this campaign will be done at fasting level. But random blood glucose level, if it is more than 2, as per international guideline, if two random blood glucose level or casual plasma glucose level is more than 200, you can put them that yes, they are diabetes. Otherwise, you should ask them to get the next day morning fasting sugar as well as their HbA1c level also. If it is random blood, if they are coming to the place where fasting plasma glucose is done, and if it is more than 126, even a single report is sufficient to tell for someone that he is a diabetic. So first is this testing campaign which we have done in India. On one particular day, a 1 million test has been done, and that is a world record. But it was a part of the campaign which we have done as Defeat Diabetes campaign. The idea was that, you know, this message should reach to 100 million or more than 100 million persons in 100 days. And that is what we have done through the social media. And all across country, more than 1,000 doctors were the part of it. All RSSB members were part of it. And 1,000 doctors who are taking actively who participated in this program. They tried to put everything on the social media, and every day we were doing so many activities. And our idea was to reach to these 100 million people, to understand, to sensitize them that how important the sugar is, how important sugar monitoring is, and how sugar can lead to many complications, and how diabetes can be prevented also, because that was also a part of our campaign. So in 100 days, we could reach almost 125 million, which is a world record itself. On social media, we could reach there. And at the same time, on one particular day, that was a World Heart Day, last 29th of September 2021. On World Heart Day, we could do for more than 1 million testing, which is done in one day. And more than 10,000 sites. Out of them, 4,000 sites from the Rotary, and another 6,000 sites were from the doctor side. The clinic where we have done the camp, it was 10 parameters which we have collected. Not only the glucose is being done, age of the person, family history, waist circumference, weight, if they are on medicines or not on medicine, whether they are coming fasting or random blood glucose level. So these many parameters which we have collected, and 7.5 lakhs parameters are perfectly, all 10 parameters are there in 7.5, which is a big number in our country. But just to tell you one thing that's very important, Rajeshji, that before 20 years and now, the average waist circumference in India is increased. So, I mean, this is some very important parameter which I would like to tell the here audience, that in 20 years, the average abdominal girth or a waist circumference, which used to be between 28, 30 or 32 most of the time, had become now 32, 34 and 36. So now I don't know whether we should change the small, medium and large, which is like 38, 40 and 42. Should we change it now to the 40, 42 and 44? This is a drastic change I could see, because we were just trying to compare with Dr. Mohan data, which he has done in 2000 cure data, which is around 56,000 persons blood sugar camp, which he has done in Chennai in 2000 to 2001. And this is the exactly after 20 years. So you can see significant. Yes, that was a single city, and here it is a multi-city program. So that's a only difference, but this a very, very significant difference is there. But this is not, a good, because increasing waist circumference means increasing risk of NAFLD, increasing risk of cardiovascular disease, and definitely increasing risk of diabetes also.
Thank you so much, Dr. Banshi Sabu. First of all, our heartiest congratulations on behalf of SOCHM and everyone present here for conducting this, I would say, humongous feat of doing so many tests on one day. I think it is a remarkable achievement. And yes, I think you're very right that the waist circumference is increasing and has increased, doubled in these 2 decades. And if I am right, the incidence of diabetes has gone up on average from 2% to 20% in the urban centers. So that is an almost 10-fold increase. So हमें पता है कि डायबिटीज बढ़ रही है, और कुछ बातें जो अभी बंशी साहब ने बताई कि 25 साल की उम्र के बाद हर व्यक्ति को हर 3 साल में कम से कम एक बार शुगर की जांच कराना जरूरी है, ये देखने के लिए कि डायबिटीज है कि नहीं, क्योंकि डायबिटीज के अक्सर कोई लक्षण नहीं होते, कोई सिम्टम नहीं होते, और बिना जांच कराए हमें नहीं पता चल सकता कि डायबिटीज है कि नहीं. नाउ continuing our topic, that is diabetes free India. जैसे हमने बात की डायबिटीज एक ऐसी बीमारी है जिससे हम सब बच सकते हैं, तो हम सब अपने देश को डायबिटीज मुक्त कैसे कराएं? I would like to come with this question to Dr. Dinesh sir. We understand that diabetes starts, it is there in our genes, and it is only the expression of those genes which can cause insulin resistance or which would ultimately lead to a full-blown diabetes. So is it somehow possible that we can do some things right at the time of conception, during pregnancy, or does that period of pregnancy and conception somehow determine whether the baby who's going to be born may develop diabetes or somewhere prevent diabetes in the future generations? So I would request you to start, and I would request each one of the panelists to join in and contribute, because I think this is one of the most important things that we should be looking forward to prevent diabetes in the future generations. Sir.
Right. Thank you, SOCM, Dr. Rajesh Kesari, all for wonderful talk. So moving forward, that we all talk about the primary prevention, secondary prevention. When we start treating patients of diabetes, that is secondary prevention. So you have talked about the primordial prevention. So primordial prevention means is the adaptation of strategy where we do not develop in the normal glycemic phase to stop in the normal glycemic period. So we have to take action on the economic front, then environmental front, social and behavior by doing the regular physical activity and normal nutritional diet. During pregnancy, as initially if we go back, it was 3 to 5% of the pregnant ladies who was found to be having high blood sugar or GDM. Now it is around 12 to 15%. So that again, the lifestyle modification come into the play. If we well control our blood sugar in our pregnant lady, then transferring to the offspring is very low. So we need to do all factors, economic, diet, environmental, we need to do. And ऐसा सब करके ही एक कलेक्टिव, एक होलिस्टिक अप्रोच के साथ हम अपने ऑफ स्प्रिंग में भी डायबिटीज को कम कर सकते हैं. क्योंकि अगर समझ लीजिए स्कूल में, आज हम स्कूल में बच्चे को ऐसा हो रहा है कि आप मॉर्निंग में देखिए किसी भी स्कूल के मेन गेट तक आपके बच्चों की गाड़ी रहती है, कोई भी आधा किलोमीटर पहले छोड़ के बच्चे को गेट पे नहीं छोड़ने जाता है. सब चाहते हैं कि मेरा बच्चा एसी में रहे और लास्ट मोमेंट तक रहे. तो ऐसी चल रहा है. अगर हम अपने बच्चों को ये नहीं सिखाएंगे कि फिजिकल एक्टिविटी करनी है, खाना है, हम अपने हर बच्चे को खाने पीने के समय टीवी ऑन कर देते हैं, मोबाइल दे देते हैं और जंक फूड के साथ बच्चे खाते हैं, तो उसको बचाना है. प्लस हमें स्कूल में एटलीस्ट इन हाई स्कूल लाइक क्लास 8, 9, 10 स्कूल में एक चैप्टर होना चाहिए. स्कूल में अपने बच्चों को डायबिटी, ओबेसिटी एज वेल एज डायबिटीज के बारे में, प्रिवेंशन के बारे में बताना चाहिए कि कितनी डेडली है, हम कैसे रोक सकते हैं. अगर हम उसको शुरू करें स्कूल लेवल पे ही एट इनिशियल फेज, हम अपने ऑफ स्प्रिंग को और अपनी फ्यूचर जनरेशन को डायबिटीज से बचा सकते हैं. हमें अपने हर स्टेट गवर्नमेंट को या सेंट्रल गवर्नमेंट को बोलना चाहिए कि देयर शुड बी अ चैप्टर इन स्कूल करिकुलम regarding diabetes and obesity and how to prevent this. This way we can save our country from the epidemic which is heading towards, and we are going to be the diabetes capital of the world. This is from my side.
Thank you so much, sir.
राजेश
सर डॉक्टर
दो
सुनिए
और बात करूंगा.
हाँ सर प्लीज.
जो दिनेश जी ने बोला है वो बिल्कुल सत्य है और इससे हम डायबिटीज को काफी हद तक रोक सकते हैं. लेकिन हमारा जो कंसेप्ट है और जो रिसर्चर का और खास करके जो इंडिया से थिन फैट इंडियन का कंसेप्ट है कि
बिल्कुल
इवन वी आर लीन बट स्टिल वी आर फैट फ्रॉम इनसाइड एंड वी हैव हायर इंसुलिन रेजिस्टेंस. एंड उसके कारण थोड़ी सी भी सीडेंटरी लाइफस्टाइल ज्यादा बढ़ने से या थोड़ा सा भी वजन ज्यादा बढ़ने से या हल्का सा पेट ज्यादा बढ़ने से हमने देखा है काफी लोगों को डायबिटीज हो जाता है. पहले काफी एक ऐसे पेपर्स भी पब्लिश हुए थे इंडिया से कि लीन टाइप 2 डायबिटीज, is it a separate entity? I mean, these persons were not exactly the obese or overweight. And long back, Europeans and Americans, they were not accepting the fact that in India, people can become diabetes. They are type 2 diabetes with a BMI of 22 because 22 BMI, it means they are insulin deficient, more or less. Still, the clusters of type 2 diabetes, which has been done, which they try to find out that those persons who have BMI less than 23, actually they are severely insulin deficient, but that may not be true for Indian condition, as we are actually lean type 2 diabetes or we are highly insulin resistant. So I'm not talking that everyone is like that. So one of the way of primordial prevention in our country could be that if we change in utero nutrition, in utero means
Yes.
in that inside the the womb only, and we can come out with a healthy baby. At present, the average birth weight of newborn in our country is 2.8 in compared to Caucasian population, which is 3.2 to 3.3. So if there is a difference of almost more than 500 grams. That's number one. The fat percentage of these 2.8 kg newborn in our country is more than 30%, while a 3.3 kg born European newborn baby have less than 20% fat percentage. So the muscle mass is different at the time of birth itself, and the weight even we have less but still higher fat percentage, which makes us insulin resistant. तो अभी यदि हमारे को काम करना है तो कुछ एक कदम और बढ़ना पड़ेगा कि जो आज हमारी बच्चियां हैं, जो आज यंग चिल्ड्रन है, उनको हम एक्टिव करें, उनका मसल्स मास बढ़ाएं, उनकी हाइट बढ़ाएं, उनकी बोन लेंथ बढ़ाएं, और उन बच्चों को जब वो आज के 10-15 साल बाद में शादी होने के बाद उनके जब नेक्स्ट जनरेशन के बच्चे हैं तो उनको फुल टर्म उनकी फुल हेल्दी लाइफस्टाइल जी रहे हो वो बच्चे, और वो लड़कियां पूरी हेल्दी लाइफस्टाइल के साथ प्रेग्नेंट हो, और उनकी प्रेगनेंसी के बाद उनको फुल टर्म बेबी मिले, वेजाइनल डिलीवरी मिले, न कि सिजेरियन, प्रीमेच्योर नहीं, पीसीओडी नहीं, उनको ऑलरेडी ओबेसिटी या पीआईएच होने के कारण उनका बच्चा इंट्रायूट्राइन IUGR नहीं. That child should be full term 3.2 kg, 3.3 kg normal birth weight. They should not have GDM during their pregnancy also. एंड देन आप उस बच्चे का बर्थ वेट होने के बाद वो न्यू बच्चे का वो 3.3 किलो होगा, और आप उसका डेक्सा से फैट परसेंटेज करिए, यू विल फाइंड दे आर एज हेल्दी एज यूरोपियन चाइल्ड. सो यू नो फ्रॉम बर्थ वी आर गोइंग टू रिड्यूस द इंसुलिन रेजिस्टेंस, एंड उसके बाद उनको थ्रू आउट देयर लाइफ टाइम दे शुड हैव ए नॉर्मल healthy lifestyle. As Dinesh was talking in the school, we should give the environment, we should not be obesogenic, and that environment not only in the pediatric age group, is a young adult going in the school or colleges, everywhere that environment should be there. So then they will be also healthy throughout their lifetime. So probably this newborn who is born healthy will not have risk of developing diabetes throughout his lifetime, because he born healthy, he have a healthy lifestyle in his pediatric and early adult age group. He was having healthy environment, no obesogenic environment, and then he will remain healthy throughout the lifetime. So that is what primordial prevention we can think of. Still, we can't think of those who are developing insulin deficiency because of autoantibody, because of their pancreatitis or secondary diabetes. You can't prevent all those diabetes. You know that there's a separate group of class of that. But typical type 2 diabetes in our country can be prevented. Yes, there are become very obese and they develop diabetes, or older age group, after 55, 60, 65, 70, if they develop diabetes, that possibility still you can't say that they can be 100% primarily prevented. But at least those who are developing in their 30s, 40s, 50, we can significantly prevent or delay the onset of diabetes in this age group. And I think that itself will consider that, you are almost preventing diabetes or you are making diabetes free.
Thank you, sir. I think this was a wonderful sharing of ideas that we should start making our young mothers healthy with enough muscle mass so that they are able to pass that on to the babies. Dr. Bhatia, sir, I would like to come to you and request you, would you like to add something to this discussion on the epigenetics and maybe the healthy mothers or the weight of the mothers and how what are your opinions on this?
Yeah, I think that's very important, this aspect of the mothers being looked after so that the the progeny can be looked after. And we know that ladies who are obese to begin with and who are pregnant with diabetes, they have large babies, and the large babies in turn develop obesity during their childhood, and therefore the risk of type 2 diabetes in the progeny increases tremendously. And it is known that they would develop diabetes much earlier, as it happens in India. They develop diabetes about 10 to 20 years earlier. But if you have a child who is born of a pregnant mother who has had diabetes and who is obese, then it's likely that the child would be obese, and that child would have a tendency to develop diabetes very early in life. And that is seen quite often. We see children of 10 to 12 years old with obesity and severe acanthosis nigricans, and they develop diabetes at 12 years of age. And that's type 2 diabetes. And the devastating effect of that is that they have a much longer lifespan. And we know that the complications of diabetes are related both to the duration of diabetes and the severity of diabetes. So if you have a child developing diabetes at 12 years, he's got about, and therefore the frequency bound to occur and all the complications of diabetes. So that's a very important aspect in the management of the pregnant mothers. And all mothers who are planning a pregnancy should be asked to reduce their weight before they conceive. And they should have the sugars tested, and they should have the sugars absolutely normal before conception, so that they don't have these risks which can be passed on to the baby. Also, the risk of congenital abnormalities is high when a mother has type 2 diabetes. So the difference between a lady getting gestational diabetes and type 2 diabetes preceding the pregnancy. Type 2 diabetic pregnancy, the outcomes are quite different from a gestational diabetes mother. Therefore, more attention needs to be placed on the type 2 diabetic mothers who are likely to have adverse complications during the first trimester as well as during the subsequent trimesters. So that's the basic idea about this problem.
Thank you so much, sir. That was very important. Dr. Banshi, sir, I'd like to ask you one thing, because we are talking about primordial prevention and prevention of diabetes. Sir, ऐसा होता है क्या कि जो बच्चे बहुत कम वजन के पैदा होते हैं, as you were saying, and when they're born, they are fed very high fat diets and high carbohydrate diets, and they gain weight. And as a result of that weight gain, they develop diabetes. Because this is something I think which is happening rampantly in our country. बच्चे जब पैदा होते हैं उनका वजन कम तो खूब खिलाते हैं माँ बाप, and as a result they develop diabetes.
So this is very, very important, you know. Actually, Rajesh, pediatric age group के अंदर जो बच्चे born पतले दुबले या लो बर्थ वेट या प्रीमेच्योर चाइल्ड होते हैं, पेरेंट्स और ग्रैंड पेरेंट्स को ये लगता है कि बच्चे को अब हम ज्यादा खिला के उसको दे शुड बिकम नॉर्मल, and they are more worried of the weight rather than the height or length of the child. That is very, very important, which I think requires a lot of education also. दूसरा मैं एक बहुत कहूँगा खास करके कि जब इनको बच्चों को पीडियाट्रिक एज ग्रुप के अंदर ही इतने मोटे हो जाते हैं तो इनकी हाइट वगैरह कम होने के कारण या ओवरऑल उनका बीएमआई बहुत जल्दी बढ़ जाता है, एंड वी हैड सीन also that they develop diabetes very young age. So as a physician and pediatrician both, we should always write what is your birth weight and how you are catching the weight. I mean, that's very important from pediatrician point of view, and they must also educate the parents, because they are not seeing this non-communicable disease. Sometimes they just try to see the pediatric endocrinology, they always try to see that how your height and weight is increasing. But if somebody is not having any stunted growth, they don't measure the height properly. ठीक है, जरा बच्चे की height कम है, लेकिन at that point of time they forget that the child is increasing actually in the weight. That is a very, very metabolically disturbing the child. तो सेकंड चीज, एक चीनी खाने के बारे में भी जब आपने इसके बारे में बात की, क्योंकि मैं एक बहुत कॉमनली मैं मेरे नून और रिलेटिव्स को खास कहता हूँ कि हमारा जो बच्चा अभी 6 महीने का हुआ है और 6 महीने बाद में आप उसको बाहर से जब दूध पिलाना चालू करते हो तब आप उसमें शुगर को मिलाते हो। उसको मीठा दूध देने की कहाँ जरूरत है? मतलब बच्चे ने तो मांगा नहीं, क्योंकि माँ बाप को आदत पड़ी हुई है कि दूध मीठा पीना चाहिए। उन्होंने चाय मीठी पी है क्योंकि हमारे माँ बाप ने, हम बचपन में थे तब पिला रहे थे, हमारे दादी दादा पिला रहे थे, और हमने वो 6 महीने का बच्चा जब उसको हमने बाहर से दूध पिलाना चालू किया, उस पर हम शुगर मिला के पिलाने लग गए थे। ये इतनी बड़ी बेवकूफी और मूर्खामी करते जा रहे हैं हम, जो एक्स्ट्रा कैलोरी उसको खिला रहे हैं, और एक्स्ट्रा कैलोरी के अलावा उसको शुगर के लिए आप उसके स्वीट टेस्ट वर्ड जो ज्यादा डेवलप कर रहे हो, और फिर वो आप जिंदगी भर कहते हो कि राजेश भाई यार मेरे तो ना बहुत स्वीट टूथ है, मेरे को तो स्वीट खाए बिना चलता ही नहीं है, मैं तो शाम को खाना खाने के बाद स्वीट खाता ही हूँ। क्योंकि वहां पर जब जरूरत नहीं थी, उस बच्चे को यदि आप वो मीठा दूध नहीं पिलाते, माँ के दूध में शुगर नहीं आती है, गाय के दूध में नहीं आती है, भगवान ने आपको वो दूध के लिए एक्स्ट्रा शुगर मिलाने के लिए दिया नहीं है, फिर भी हमने एक बढ़िया सा बिल्कुल प्योरीफाइड किया हुआ अच्छा सा दो उसमें चम्मच मिला के बच्चे को एक पूरा बोतल भर के पिला रहे हैं। आई मीन देयर इज नो रीजन व्हाई इट इज बीन डन। Just forget about the weight and all these aspects. And this simple message, if we just start giving to all our pediatrician friends, all our physicians, and even if we start doing for our family members, आपके घर में, आपके आजू बाजू में या जो भी न्यूबॉर्न होने वाले हैं, यदि हम एक सिंपल ये मैसेज दें कि आप उनको देने की जरूरत नहीं है, वो बच्चा नहीं मांग रहा है, उसके बच्चे को नहीं जरूरत है, आप ऊपर से गाय का दूध दिला रहे हो, वो सफिशियंट है उसको, और वो उससे काम हो जाएगा। आप उसको एक्स्ट्रा कैलोरी भी नहीं जाएगी और एक्स्ट्रा शुगर भी उसकी आदत मत बनाइए। तो आप देखिए वो बच्चा 2 साल 4 साल 5 साल 7 साल का, उस बच्चे की आदत नहीं पड़ेगी। और दूसरा
I think
yes त्रिपाठी,
yeah, one point at this I like to make that at the age of 3 years they say all the babies who are born underweight or low weight, at the age of 3 years they have a reversal of the weight and they start gaining obesity or gaining weight after that. And that is also a very important fact to note. And that is not related to the diet that they are given. That is genetically ingrained in them, and they develop obesity up to the age of 3 years. So low birth weight children become obese, and they develop the risks of the obesity in their future life.
But low birth weight child, there is a direct correlation seen that they become more obese and there is the more chances of developing metabolic problems in their adult life in compared to the children who are normal.
Who are the normally weight.
So
right.
I mean that's
low birth, yes, I agree with Dr. Mansi Sabu. Low birth weight, feeding more and then gaining weight, developing diabetes. I think this is true.
Especially when they're born low birth weight and they gain a weight in the initial years of life. I think that is more detrimental and increase the chances of developing diabetes and insulin resistance and obesity in the coming years of life. I think there's very important point, which is that mothers who don't have normal glucose tolerance, but who have some degree of impaired glucose tolerance at very initial stages of pregnancy, if the sugar levels are not controlled, then the pancreas of the fetus starts compensating for them. So maybe there's a priming of the pancreas. Dr. Badi, sir, would you like to comment on this?
Yes, this is a very famous hypothesis, and this is that if the sugar levels are high in the mother, the sugar level goes across the placenta to the baby, to the fetus.
Yes, sir.
And the beta cells in the pancreas
So we can't hear you. Dr. Tripathi, sir, I think there's some bandwidth problem. Can anyone hear Dr. Tripathi?
I think he is connected with mobile. Tripathi.
I think there's some problem with internet.
You can keep your video off and you can just talk. So I think that will be better. Keep your video off and just talk on phone. So at least we can listen you.
Me?
So yes, we can hear you now, sir.
Yeah. So what I was saying is
sir, please speak.
When the blood sugar levels are high in the mother and they go across the placenta to the baby, then they stimulate the pancreatic beta cells at an early stage, and that leads to a premature failure of the beta cells. So the pancreas does not work ultimately, and that causes a premature development of diabetes in the offspring. So that's an important hypothesis, and that has been seen very often. And it is also a fact that certain vital organs need to be protected. So those are protected, but the less vital organs, so to say, are sort of susceptible to damage. and they cause these various issues related to the development of diabetes in the progeny.
Thank you, sir. So one very important thing that I think we should focus is on the mothers, that we should have healthy mothers, they should have healthy mass, and they should not have diabetes, and they should not have any form of glucose intolerance. तो जैसे जाते हैं कि अगर माँ healthy हैं तो बच्चे भी healthy रहेंगे. Now I would like to come to the issue of pre-diabetes. Dr. Banshi Sabu sir, would you please elaborate a little bit on pre-diabetes, because मैं तो अपने मरीजों को कहता हूँ कि अगर आपको pre-diabetes तो आप डायबिटीज की दहलीज पे खड़े हैं. अगर आपने अभी आपको कंट्रोल कर लिया
है डायबिटीज का दहलीज वर्ड और जो बॉर्डर लाइन, लेकिन इसका राजेश जी कई जनों ने बड़ा उल्टा फायदा करने लग गए. जिन लोगों का 200 के ऊपर है वो भी अपने आप को बॉर्डर लाइन डायबिटीज बोलते हैं. जिन लोगों का HbA1c 7 के ऊपर है वो भी अपने आप को बॉर्डर लाइन डायबिटीज ही बोल रहे हैं. उनको लगता है 7 तो कंट्रोल के लिए है. मेरा तो डॉक्टर साहब बिल्कुल बॉर्डर लाइन रहता है. कितना HbA1c है तो देखते हैं 7.3. अरे भैया 6.5 के ऊपर डायबिटीज तो डिटेक्ट हो जाता है. So we have to define it very clearly that this is between 5.8 to 6.4. If somebody develops 6.5 or above, then it means he is diabetic. That's number one. The pre-diabetic population is giving you an opportunity for a prevention of diabetes, where we are successful only by lifestyle modification. And that's very important thing. Yes, some of them can be given if they are at very high risk, where fasting is also high and post meal is also high, coming in between a range of 110 to 126, or instead of 140 IGT, they are almost like 180 or 190, or their HbA1c is almost touching 6.2 or 6.3 or 6.4, then even the metformin can be also given. But there is no, a recommendation. But this depends on individualization of the person. But what I do in my clinical practice, that we educate them. We tell them this diabetes can be prevented. This is the stage where you can 100% reverse your possibility. And we give them target of coming out below 5.5, like a non-diabetic, your other persons in the family who's not diabetic. You should try to achieve the same HbA1c and aggressively controlling their sugar part. Now, one part is sugar, but pre-diabetic population is also at the higher risk of developing CVD. And that's very important point. They are equally at the risk of developing heart disease, because both, the heart disease and diabetes primarily both have a common soil pathogenesis, and that's the reason we try to, other risk factor aggressively control for these persons. If it's smoking, cessation is important. If lipids, lipid lowering agents are important. If hypertension, treat them for hypertension. So they are the typically persons of metabolic syndrome, where I have to treat all other aspects. And we should talk about pre-diabetes. कि ये borderline diabetes का मतलब ये है जब हम 6.5 से नीचे हैं. 6.5 के ऊपर को borderline नहीं कहते हैं. जो हमारे काफी हद तक बहुत जने लोग उसको borderline को diabetes कहते हैं. जस्ट 4-5 दिन पहले जो डेटा रिलीज हुआ IDF में 534 मिलियन ऑल ओवर द वर्ल्ड डायबिटिक पॉपुलेशन है, पर 541 मिलियन यानी उससे भी ज्यादा लोगों को प्री डायबिटीज है. सो ऑलमोस्ट इक्विवेलेंट लोगों को डायबिटीज पूरी दुनिया के अंदर है. यानी 100 करोड़ से ऊपर के लोगों को डायबिटीज पूरी दुनिया में है, या डिस्ग्लाइसीमिया एटलीस्ट हम ये कह सकते हैं. आधों को प्री डायबिटीज है और आधों को डायबिटीज है. अनलकीली जिनको डायबिटीज है उसमें से 50% लोगों को ही पता है उनको डायबिटीज है. यस डॉक्टर सुधीर भाई, प्लीज. Dr. Sudhir wants to make some comment. Yes, sir, please.
Yeah, I just had a comment to make. Can you hear me?
Yes, sir. Yes, sir. Yes, we can hear you. We can see you.
This was a study which was published just about a week back on 4th of November. This was published. And this is a study from Scotland, which showed that there's a 5% reversal rate of diabetes in their population in 2019. And this was, they had reversed diabetes, and for a year, without any medication, the HbA1c levels were less than 5.7%. So that was a very significant study, and this has shown that this is possible. Now, this concept of reversal of diabetes is very prominent, and it has happened in Scotland. And this is very recent, only in 2019 they succeeded in doing this. And this can be implicated or sort of taken note of, and this can be inculcated in all the other countries where it is possible to reverse diabetes. A lot of patients come today and they say, "Doctor, can my diabetes be reversed? What should I do to reverse my diabetes?" So that's a very new concept, which is very important to emphasize on, that you can reverse the diabetes indeed. and you can get rid of all the complications of diabetes and maintain your normal glycemic status.
Thank you, sir. So since we are discussing pre-diabetes, what would be your suggestion to patients who are in the state of pre-diabetes?
Who have?
Pre-diabetes. How can we prevent the progression? I'm not talking about the remission or reversal of diabetes. What, in your view, is the best, would be the best recommendation for patients with pre-diabetes? Is
I think
diabetes, exercise, diet, or medication? What is your?
I think the best form of treatment for a pre-diabetic patient is exercise and diet, because we know for a fact that exercise and diet are more effective in preventing the development of progression to diabetes compared to the use of medication. The various prevention programs that we've studied earlier, the diabetes prevention program, that has shown that about 58% of patients can be prevented from developing diabetes with the use of only diet and exercise, whereas only about 35% patients are prevented from developing diabetes when they use metformin. So diabetes can be prevented from developing in a pre-diabetic patient with predominantly just lifestyle modification. And in this study, for instance, in the study which was published in Scotland, they showed that if you have a 15-kilo weight loss, that reverses diabetes. So if you have a similar kind of weight loss in a pre-diabetic, if not similar, at least to that extent or lesser than that, one would definitely be able to prevent the development of diabetes. I think the environmental factors are more important. There's a slide I remember having read somewhere that if you have a patient with the same genes and the same risk for developing diabetes, he's a pre-diabetic, but if you have the environmental factors which can be taken care of, then the development of diabetes is totally negated. So it is very important to prevent the development of diabetes by just lifestyle measures and weight loss. You don't need any medication for that.
Yes, I think that is a very important message कि वजन कम करना, अपनी डाइट पे कंट्रोल करना और डेली एक्सरसाइज करना डायबिटीज से बचाव के बहुत ही 3 आवश्यक संसाधन है. Dr. Dinesh sir, I would like to come to you and ask you about the relationship between stress and diabetes. Are they related?
Yes, स्ट्रेस अपने आप में डायबिटीज की जननी भी बता सकते हैं. आज के दिन में अगर हम सोचें कि स्ट्रेस आपका नौकरी का है, आपके वर्क स्ट्रेस है, वैसा नहीं है. आज स्ट्रेस बच्चे लेवल पे शुरू हो जाता है. आज हम अपने बच्चों को, जब उनका सैटरडे संडे आता है, छुट्टी का टाइम होता है, तो पेरेंट्स और बच्चे दोनों का स्ट्रेस बढ़ जाता है. हम उसको स्विमिंग स्कूल भेजना चाहते हैं, हम उसको डांस स्कूल भी भेजना चाहते हैं, हम उनको क्रिकेट भी करना चाहते हैं. हम हमारे बच्चे को वो सब कुछ देखना चाहते हैं जो एक आइकॉन देखते हैं. हम उसको विराट कोहली बनाना चाहते हैं, हम उसको फुटबॉल का टॉप, वी वांट एवरीथिंग नंबर 1 टू दिस. तो हमारे बच्चों को भी उस समय स्ट्रेस है. तो वो स्ट्रेस जैसे कि जेनेटिकल चेकअप चेंजेस होना शुरू होता है, तो हमें अपना स्ट्रेस भी कम करना है, अपने बच्चे का भी स्ट्रेस कम करना है. और जैसे जैसे न्यूक्लियर फैमिली बढ़ी है, वैसे वैसे ये स्ट्रेस बढ़ते जा रहा है, बिकॉज बच्चे कम हो गए, संभालने वाला वही है, सेम पेरेंट्स को ही सारा काम करना है, दोनों बच्चों को संभालना है. तो स्ट्रेस डेफिनेटली डायबिटीज को हार्मोनल चेंजेस करके डायबिटीज को बढ़ाने में मदद करता है. एक पिलर हो गया स्ट्रेस. तो स्ट्रेस कम करके हम डायबिटीज को कमाने की कोशिश करनी चाहिए.
So stress causes a rise in the cortisol levels, and cortisol levels are known to be diabetes.
True.
Definitely. I would request you to suggest some changes in our food habits, because generally food habits तो हम सबकी एक जैसी होती हैं. क्या ऐसी food habits हैं जो change करके we can maybe decrease the progression to diabetes or prevent diabetes?
डॉक्टर राजेश, ट्रू. अभी जैसा कि है, जैसे कि हम सब चल रहे हैं कि आज जंक फूड या कोल्ड एरिएटेड ड्रिंक का ज्यादा जोर है. अब कभी भी हम जाएं पिज्जा में, तो हाई कैलोरी डाइट है. हर आदमी आपके घर में या हमारे घर में आते हैं, वो पहले बोलता है नहीं मीठा अवॉइड करिए, मेरे को चीनी की चाय ना दीजिए. लेकिन एट द सिमिलर टाइम वो समोसा पकौड़ा बड़े आराम से खाते हैं, इसमें तो चीनी नहीं है. बट वो इस चीज को भूल जाते हैं कि 1 चम्मच शुगर गिव्स यू 40 कैलोरीज, but 1 teaspoon of oil or ghee will gives you 100 calories. So it is around 2.5 times more than that. तो जब भी हम समोसा पकोड़ा कुछ भी बनाते हैं, that takes a lot of oil. वो saturated fatty oil है, that is dangerous again for the high cholesterol, high triglyceride and as well as high calorie. तो उसका भी बढ़ाना है. 1 लीटर कोल्ड एरिएटेड ड्रिंक जैसे हम कोका कोला, थम्स अप, वाटर, दिस गिव्स अस 330 कैलोरीज. बट हम कभी नहीं देखते. अभी डाइट ऐसी हो गई है कि आप डिनर में या लंच में हर आदमी बोलेगा एक मेरे को कोल्ड ड्रिंक दे दो साथ में खाने के, पानी की जगह वो कोल्ड ड्रिंक पीता है, बट वो हाई कैलोरी डाइट है. तो वी शुड अवॉइड ऑल दिस थिंग्स टू प्रिवेंट progression from pre-diabetes to diabetes or heading towards to the weight increase and pre-diabetes to us.
Thank you, sir. Karan Tripathi sir, are there any comorbidities या ऐसी कुछ बीमारियां हैं, or are there any medications which are usually prescribed which may lead to progression and development of diabetes?
Yes, there are a lot of drugs which are used. I think the commonest drug one would implicate for the development of diabetes is steroids. We've seen that in the COVID epidemic, and we've seen it in other patients also, like transplant patients. They given steroids, and they develop, that's called new onset diabetes after transplant. NODAT is the terminology. Similarly, we've had new diabetes developing after the COVID virus infection, and it is known that the COVID-19 virus can attack the beta cells. And this is like a type of type 1 diabetes. It's not known exactly what type of diabetes. There's no terminology given to it, but it is presumed to be type 1 diabetes because of this COVID infection. So various infections in the past have also caused type 1 diabetes, and COVID is another virus which is responsible for type 1 diabetes development. And the drugs indeed are, we've talked about the beta blockers. Beta blockers, of course, don't cause diabetes, but they can mask the effects of the hypoglycemia in a diabetic patient. And so there are a huge number of drugs, and there's also, like in the yesteryears, there are certain poisons that were used which are affecting the beta cells. Like we had the pentamidine, which was a drug which is used to, and that can affect the beta cells of the pancreas. So there are a large number of drugs which can cause diabetes, and also various other conditions which can cause diabetes. One must be very careful of what one is using when one treats a patient, which can implicate the or affect the pancreas, and that's a very important fact.
Thank you, sir. I know we are running out of the time, but one last question to all of the panelists. Is there going to be a vaccine against diabetes? Because everyone is very interested to know कि क्या डायबिटीज की भी कोई वैक्सीन निकलने वाली है या आ चुकी है? So anyone would like to comment? Sir, yes.
I think as far as the type 2 diabetes is concerned, it's a very heterogeneous disorder. There's so many factors and there's so many genes which are implicated, at least 15 to 20 genes which are implicated in various types of type 2 diabetes. And there's so many other the environmental factors. I personally feel that there's no vaccine which could prevent type 2 diabetes. But I like the other panelists to have their suggestions or comments about this. But I personally feel that there's no vaccine which would come in to prevent type 2 diabetes.
I agree with Tripathi sir. I don't think in near future we are seeing some vaccines against type 2 diabetes.
Dr. Banshi sir, is there going to be a vaccine for type 2 diabetes?
The vaccine is lifestyle modification only.
Exactly.
The best vaccine, which I think everyone should know, that diabetes is a preventable disorder. And as Dr. Sudhir and Dr. Dinesh was also talking, that we should talk more and more to our persons that diabetes is a preventable disorder. And in layman, in a public awareness, everywhere we should talk that diabetes ko roko or complications ko roko. So, I mean, if primarily we can prevent the diabetes, we can prevent many more complications of diabetes also. So that's the only and only vaccine, and it's a lifestyle modification. It's a healthy lifestyle. It is not for a few days, nothing like a dieting program and doing exercise only for a few days and otherwise skipping and then doing cheating and all those things will not work. It has to be lifelong. And मेरे को लगता है लाइफ लॉन्ग के लिए जब आदत बनानी है कोई चीज को, तो जैसे दिनेश बात कर रहा था कि किताब में डायबिटीज के लिए लेक्चर होना चाहिए. इट्स नॉट ऑन डायबिटीज लेक्चर. लॉन्ग बैक एंड दिस टाइम आल्सो व्हेन वी मेड द हेल्थ मिनिस्टर, you know, the delegation RSSJ, we had given a white paper to them, and regarding prevention of diabetes we talked that there should be a dedicated health science. A booklet should be there on health science, and that the child should read from class 5th to 8th or 9th till he go to the secondary school. And there we will not be talking only on diabetes. It's not for the diabetes. It is like how a healthy life or a healthy living one should have. It is on nutrition. It is on infection disease prevention. For every aspect of the life, there should be a book called health science, like the book we have social science, or like we have on any other subject on a similar way. So if child is trained in a young age, if somebody is knowing the importance of health and importance of diet and importance of regular exercise, I'm sure many of them will follow it throughout their lifetime, and you can see the significant decrease in the incidence of these metabolic problems as well as in diabetes problem. The
Thank you
other
so
good
much.
example we can take from the Israel.
Yes.
Israel made the rule is those who are above the age of 16, between 16 to 25, minimum 2 years and around 3 years most of the time, they have to spend their time for the army. So if somebody goes
Yes.
between that 16 to 25 years for 2 to 3 years in army, that's sort of a discipline, that's sort of an exercise, that's sort of a lifestyle which they adopt during this army training, and then they continue. Most of the time, if you will find in Israel, 45, 50, 55, 60 तक आदमी आपको बिल्कुल healthy and एकदम smart, and they will look very slim and lean only. And only above the age of 60 only they become slightly overweight and obese when they stop their exercise. And you will find the incidence of diabetes is comparatively less, and it is only in that age group in the 6th decade or 5th decade, not in 3 or 4th decade like we have in our country.
Absolutely
The
true.
vaccine is lifestyle modification only.
Sir, just a moment, Tripathi sir.
Yes,
Dr.
please,
Sabu,
Deepati,
I'd
wants to
come
make.
back to you and request you to give a 3-dose vaccine with tips, and I would request all of you panelists to give 3 tips to our listeners, 3 doable, actionable things. And I would request Colonel Tripathi sir to continue. Sir.
Yeah, I just had a point to make that, for instance, this November is a very interesting month. I was just reading the number of days which are celebrated on November 14th. Firstly, you have the World Diabetes Day, then you have Children's Day, then you have November is also celebrated as National Diabetes Month by the NIH of the United States, and there's also it's called the ULA Day or Lulu Day. When you just give up, there's also an give up your apps day. So 14 November has got 4 or 5 interesting days, and all of them would contribute to the prevention of diabetes. If you have Children's Day by Pandit Jawaharlal Nehru birthday, so that's Children's Day, and the children these days can be amalgamated. You can have the children focused on children with diabetes as the driving force. So someone has to take this decision to sort of amalgamate the 2 days of the Diabetes Day and the Children's Day, and also the day when you can have an entire month, actually the National Diabetes Month you can have, during which the awareness of this disease would increase tremendously. We still have a lot of people who don't know much about diabetes. They heard it and they feel that just a touch of sugar. And like Dr. Bansi Sabu said, even if you have a sugar of 7%, he says, oh, it's not very high. And classically, the patient would say, it's just a touch of sugar. Why should I bother about it? So that's not the right concept, and you should not touch of sugar. It's a devastating touch of sugar and can lead to deadly complications. I think one has to focus on this at a very broad level. Like International Yoga Day was promulgated by Narendra Modi. So similarly, you could have National Diabetes Month where you can promulgate these various concepts to the people of India, especially to the youth.
Thank you, sir. I think this is a very good suggestion, and this should be taken up by bodies like RSSTA. Now, I'd request Dr. Dinesh Agrawal to give a message. I would say that a vaccine in form of your message to our listeners, how to prevent diabetes.
It's a lifestyle modification, education, and awareness at each and every level. That is going to prevent, avoid, as we have discussed, starting from our family members nearby to each and one and all, children's, everything. So it's a lifestyle modification, education, and awareness. This is all about where we can.
Thank you, sir. Dr. Bhatti sir, I would request you to give a message to our listeners, some things that they can do, some actionable things.
I think the actionable things, I feel they should be very concrete, actionable things. It's not a general statement that you must eat well and you must exercise regularly. I think we must force it down their gullet that they must do this. Like, for instance, if you remember during the Corona days, they had, I think the Chief Minister of Delhi, as well as Gurgaon, they had streets where they didn't let the traffic come. And they had people just walking or playing on them. On Sundays, if I remember, a lot of people used to skate, play tennis, or play badminton on the streets. And that is what needs to be done even in Delhi. And that should not be just one time event. It should be a continuous event. You go to the West, you see in Europe, when you go to Europe, you find there are streets which are not, the traffic is not allowed. And you have hordes of people just walking. People walk a lot in Europe. And if you have, even in the middle of the day at 12 o'clock in the noon, you can find about 10 people running on the streets with their vest off, and they're just running bare chested and on the street or cycling. So that is the type of motivation that we need to give to us. Somehow we don't have this motivation. And as has been said earlier by Dr. Bansi also, that we are lean fat Indians. The classical example given is of Dr. Yudkin and Dr. Yagnik from India. I'm sure you've heard about that. And they had the same BMI, but they had Dr. Yagnik had tremendously increased amount of intra-abdominal fat. So this is very important, that we must just make sure that this happens. We just cannot say that follow a diet and follow an exercise. But you must make sure that you follow it up with action. It should be actionable and they should produce the results. So endpoint should be there. They should reduce their weight and they should not prevent the progression to diabetes. I think that's more like the dictatorial attitude that one should have to prevent diabetes.
Thank you. I think, and it is very important. It actually has to be probably dictatorial, because people don't understand how much they gain by preventing diabetes. I'd like to come to you, Dr. Banshi Sabu, and request you to deliver your vaccine.
Thank you, Rajesh. And I fully agree with Dr. Sudhir and Dr. Dinesh. They had already given a very important message for everyone that how diabetes can be prevented, or what should be the message on this World Diabetes Day. As this World Diabetes Day, we have a theme of access to diabetes care. And why this theme is being given by International Diabetic Federation, as 2/3 of diabetic patients all over the world are in middle or low income countries. That is number one. In middle and low income countries, the access to diabetes care, here we are not talking of only the diabetic medication or insulin. It is also to the access to the doctor or a doctor who is diabetes specialist who can take care of these persons with diabetes. That is also poor. And these are the two reasons. The awareness about this has to be increased all over the world. The second part of it, that economic impact of diabetes itself is very high, and along with the complication, as I told you, that it is 2/3 of diabetic patients are from middle and low income countries. So you can understand, by increasing the diabetes, actually the poverty is increasing. It is also causing more problem for our country, also economy of our country. So the prevention is the mitra, and that is only the mantra. How we can prevent? Like already Sudhir had talked, that it is the active lifestyle, the way Yoga Day is celebrated. I think now this is the time that in India we should celebrate Diabetes Awareness Month by the government. Yes, we doctors are celebrating this month of November as a healthy month, or to increase health awareness, or to increase about diabetes awareness, and we call it a Diabetes Awareness Month, but it should be at a national level. And we should try to motivate more and more people for walking, for jogging, for cycling, for exercise. Government should take care of making dedicated path for cyclers, for walkers, for all those things. So multiple such things are to be happen. A complete ecosystem has to be done. Not just the doctors only can do it. Is if everyone is involved in it, this system, I'm sure diabetes can be prevented. But till that, a simple mantra is a healthy lifestyle, which means a regular almost 80 to 90 minutes. I will just not go with the 30 minutes of walk, because along with 30 minutes walk, we need 15 to 20 minutes of muscle exercise or muscle strengthening, and another 15 to 20 minutes, maybe yoga, stretching, and abdominal exercise with 5 or 10 minutes rest. So it means almost like 90 minutes of exercise is required every day. The food which we are taking of more of carbs, so make it less carb, having more fibers, more proteins in the diet, and will have more satiety value also, and it will decrease the overall calorie intake with the person. And the last, which every one of us can do, like we all are sitting here, we can work with a standing culture. I mean, the standing culture, if we can do in our system, most of the time we people are remaining most of the time in 8 or 10 hours, 90% of the time it is the sitting culture. If we can just make it standing, the abdominal girth which is increasing, and the calorie consumption in sitting and standing is high, and most of the muscles will be very active. That will also increase your calorie consumption, will make persons more fitter than rather remaining in throughout the day only in sitting position. So few simple mantra which we can do, some more exercise, some more better diet control, which we all are now conscious, but slightly you become more conscious about the diet, more fibers, how you can put, how more protein can be there in the diet. And from sitting to the standing culture, if we come, I'm sure the diabetes can be significantly decreased. एक बहुत बढ़िया small steps and big rewards. So these are very baby steps which we can take, but the rewards will be very, very big in coming years. That is what I think.
Thank you, sir. That was really very wonderful, and that was something doable and very important. I would just like to add here three things which I always share with my patients. That is, try to avoid three whites. That is salt, sugar, and maida, because all these can also be detrimental and lead to so many problems in life. I'm so thankful to all of you, to the esteemed faculty who spent so much time. Now I would request Shri Anil Rajputji sir to give a vote of thanks to everyone for being here. I think we had a wonderful session. Sir.
Thank you very much for a very engaging session, and I think all the listeners must have taken many lessons, and a lot of awareness has been created by mass testing, as Dr. Sabu had mentioned. And very interesting discussion that how we have to going forward making mother healthy, for having a healthy India. And I think this is a lesson that we need to spread all across the country in a much more aggressive manner going forward. And Dr. Agarwal mentioned that younger generation need to be physically more active in school. And I think we all can work, and it doesn't cost money. There's no economic cost for it as much as a mindset that we have to work with the school teachers and others. And I think from SHM, we will try and see how we can take this whole message forward. Another very important point was made that mothers need to reduce weight before they go for pregnancy, and Dr. Vanshi had mentioned that height and length of child is more important. People should not if they're low in weight when they are born, parents should not get overly anxious about that. And there are many other things, that the parameters that they can focus on, because otherwise you are disturbing the metabolic of the children and making them unhealthy going forward in the life. Exercise, the whole concept of exercise cannot be overemphasized. Our panelists have said that the real mantra is that you need to exercise yourself. You need to have more balanced diet going forward. You need to create more awareness amongst the people that this is a disease. It is spreading very fast, and how we all can work together in sensitizing more and more people. And very interesting comment was made by Dr. Sabu that diabetic ko roko, and we need to create a booklet on health sciences, which children can be distributed, or we can work with government Ministry of Education, and how this can be brought about in the school curriculum. We can work together, and how Dr. Tripathi's comment, we can take it forward of having a diabetic day or diabetic month, and how government can be sensitized on this going forward, would be a great lesson that we all have picked up today from everybody. And last but not least, the comment made by Dr. Sabu that complete health ecosystem has to be created in the country. So thank you very much for coming and sharing your thoughts, your ideas, and I'm sure our team has made note of this, and whatever from SHM team we can take them forward, we would be very delighted to do it. And thank you very much for your time. Most grateful. Thank you.
Thank you.
Thank you.
Thank you.
Thank you, Mr. Rajput.
Thank you,
Thank you,
Rajesh,
sir.
for inviting
you.
us.
Thank you.
Thanks.
Thank you. Thanks everyone.
Dinesh bhai,
Thank you.
Sudhir bhai.
Thank you so much, sir.
Thank you.
And
Thanks
Dr.
a lot.
Kesri.
See you, Sri Anil
Thank you.
bhai.
Thank you.
Thanks.
Thank
Thank
you.
you.